Hello, my name is Bob Phillips, paediatric and teenage young adult oncologist at Leeds in the Children's Hospital here, and also an academic working at the Centre for Reviews and Dissemination at the University of York. So I'm part a proper doctor and part a researchy sort of doctor. When I think about fertility and fertility preservation, thinking about young people who are undergoing treatment for cancer, I think it's an extremely important topic and needs to be addressed early on when you're talking about the diagnosis and the treatments that you might be offering. Some treatments have an effect on fertility, and that effect would be to reduce the fertility in later life usually. Other treatments don't particularly have an effect on fertility. Whichever it is, that conversation really needs to be had and had early on. It's not an easy conversation to have for some people, and like other difficult conversations where you're talking about cancer in the first place or talking about how cancer treatments may not work well, then those are things that you need to practice and train for and be supported in doing. In order to make those conversations better, we need to both actively do the conversation, but we also need feedback and training. And in order to get that feedback and training better, then we need to do research. The research will help us enable to understand what it's like to be on the receiving end of those conversations, what some people find helpful and what some people find unhelpful. Along similar lines, we need to understand how to give information about fertility and about risks for fertility for people that have already been whacked by an enormous amount of bad news when it comes to having a diagnosis of cancer in the first place. Putting all of that information together is actually part of an ongoing research study, particularly looking at fertility in young women within the Yorkshire area, and that's called the Cancer, Fertility and Me study. What the team there are involved in doing is producing a booklet that they're trialling, that is, they're testing out with people to see if it helps them understand fertility and fertility options. There's always going to be a trade-off between trying to preserve fertility before treating cancer and getting on and treating the cancer. What that trade-off is depends a lot on the type of treatment that's going to be offered and also the type of cancer that's being treated. Personally, I find one of the hardest conversations is to talk to somebody that has a life-threatening cancer that needs treatment urgently within the next few hours or days, and they will have their fertility affected, or at least have a high chance of having their fertility affected, and yet there isn't time to undergo fertility-preserving practices prior to cracking on with the anti-cancer treatment. That's the ones I find hardest with. I think there is a good awareness of the need to talk about fertility and the potential effects of cancer, its treatments upon fertility amongst many teenage young adult oncologists that deal with the subject a lot, but it may not be the case in all of our colleagues. How we can make that more obvious is by holding special events where we raise it as an issue and enable people to discuss the sorts of problems that they've had and the sorts of things that they've faced. And the group TYAC, which is a professional organisation bringing together loads of different sorts of professionals, so sort of oncologists, the nursing staff, research staff, physiotherapists, everybody that deals with teenage and young adults with cancer, bringing all those people together in order to discuss fertility and what it means and how we can take things forwards. We need to do better research to see how we can support people and how we can make those conversations work better, and we need awareness raising. That has twofold, really. It helps people who may receive a diagnosis of cancer to be aware that they are able to have these conversations. And it also, I think, means that the oncologists and haematologists on this side of the table feel easier about having those conversations, in that there's some sort of groundwork set there and people are already aware that things happen.